Hello, everyone, and welcome to today's MinMD Real Talk webinar, Injection Therapy Online Clinic. My name is Austin Hunt, and I'll be your moderator for this event. I work on the marketing team here at MinMD, and I'm excited to be hosting this session today. Before we get started, we have a short disclaimer that we need to review.
The health and medical information provided during this webinar, as well as the questions and responses from the webinar providers, are solely for informational purposes. This content is not intended to take the place of advice or treatment from health professionals. Nothing presented in the webinar is intended to be used for medical evaluation, diagnosis, or treatment. It is not intended to substitute for your relationships with your own healthcare and pharmaceutical providers. Always seek the advice of your healthcare provider before beginning any new treatment, or if you have questions regarding a medical condition.
All right, with that being noted, I'm pleased to introduce today's presenter, Dr. Justin Houman. Dr. Houman is a fellowship-trained male reproductive medicine and surgery specialist. His focus is on men's health, including male hormone management, sexual and ejaculatory dysfunction, male fertility, male incontinence, and Peyronies disease, and is located in Los Angeles, California. Today is going to cover injection medication, syringe and dosing, injection techniques, support options, provide a brief demo, and then hold a live Q&A to close out the webinar. So without any further ado, I'd like to kick things off by welcoming our presenter, Dr. Houman. Over to you.
And briefly here, I'll just introduce myself. Thank you everyone for taking your time out of your evenings to listen to this, and hopefully everyone learned something. But briefly, as Austin mentioned, I did my residency at Cedars-Sinai Medical Center, then I went to UCLA for my fellowship, specializing in men's health, sexual reproduction, medicine and surgery. So I see everything in terms of testosterone management, erectile dysfunction, sexual dysfunction, infertility, incontinence. But a huge component of my practice is obviously sexual dysfunction. So that's what we'll dive into today. And we'll just jump right into the erectile. Before we go into the injectable therapies, we'll talk about what an erection is and what you need, what you need in order to have an erection. So the erection process, really it's four parts. The first part is you have nerves. If anyone is familiar with prostatectomy, for example, the nerves that we're talking about are the ones that ride along the prostate. So these are the nerves that could potentially be injured during any type of prostate procedure, whether it's for prostate cancer or radiation. So those nerves, what they do is they send a signal to the vessels, to the arteries of the penis, and they essentially induce them to dilate. And on that dilation, blood flows into the penis. So as it says here, number 2, muscles around the arteries relax, more blood flows into the penis. As the blood flows into the penis becomes rigid. It becomes rigid and erect. And then it's not just blood flow into the penis, it's the veins outside of it, as you can see here in the blue on this cut drawing here. Those areas have to compress so it doesn't let the blood out. Essentially, the blood has to keep coming in, preventing blood flow out, and that gives you that rock hard, strong erection. So this is the normal physiologic erection. Now, many things obviously could go wrong here in terms of the erectile process. Things such as not having good nerves due to some kind of therapy, poor blood flow into the penis in terms of the arterial blood flow, or then also there's issues with venous leak where the blood isn't able to stay there, it comes out rather than staying in. So there's different treatment options available for all of this. One of the more common ones and more efficacious ones is obviously intracavernosal injection therapy. So if no one is familiar with intracavernosal injection therapy, we'll go over it here, where essentially what it is vasoactive drugs are injected directly into the 2 erectile bodies of the penis, creating that vascular arterial dilation and ultimately blood flow coming into the penis with the hopes of giving you a good, strong erection. Now, there's different injection formulas. The common mixtures are one of 2 or 3 components. So essentially, the 3 main common ones are alprostadil, also known as prostaglandin, papaverin, as well as phentolamine, and these all work in different ways to increase blood flow into the penis and prevent arterial blood flow, essentially the arteries from constricting, just creating good dilation of that arterial supply into the penis. Now, when you have all 3, when you have all 3 components in it, it's called trimix. When you have 2 of the 3, it's called bimix. And every once in a while, some patients will only be on one component. However, obviously that's much less often. Bimix and the trimix are more commonly used and efficacious. So the medication concentrations, as I mentioned, bimix and trimix. So really the beauty of these formulations are there's not just different concentrations, but different dosings. So some way, somehow, we'll find you a good regimen to be on. It may take a little bit of time to find it, and most patients, starting at a low dose of trimix helps, or I mean, essentially it helps them achieve good erections. However, for those that don't, we could increase the concentration, we could increase the volume. Sometimes the trimix isn't so, they experience a little bit of pain with the trimix, so we could put you on the bimix. That way reducing any side effects, but also maintaining good, strong erections as a result of it. So that pain that I'm talking about, it's mostly the alprostadil component, as you can see here on the bottom left of the screen. It could cause an aching sensation about 1 in 5 guys. So if that's the case, we'll put you on, we'll put you on bimix, and in doing so, we could maintain good efficacy while also minimizing that side effect of penile pain. So when it comes to obviously, there's a taboo associated with injecting yourself or injecting your penis, obviously with a needle. But the good thing to know is that the needles that we use are insulin syringes, so they're tiny. They're very, very small. The gauge of the tip of the needle is increasingly small, and it does a good job in terms of getting that liquid in there, getting those vasoactive components within the penis, while also minimizing the pain. So as I mentioned, the vasoactive substances are injected directly into one of the erectile bodies. The 2 erectile bodies are connected, so if you inject in one, it will diffuse into the other side. And it has, the needle has everything on it in terms of the information, so you can see how much, you know exactly what volume you're giving once we find that good medication, whether it's a trimix or bimix, and also finding a good volume for you. So it's very simple, it's very straightforward. And here on the bottom right, when it comes to the dosing, this is also important to know. So sometimes we'll say 30 units, 50 units, 100 units. So the needle, and I'll go over this a little bit later, the needle or the syringe, it's 1 milliliter or 1 cc. So when we say 30 units, we're saying 0.3 cc's. When we're saying 50 units, we're saying 0.5 cc's. That's just another way of memorizing it, making sure that you're giving yourself the right dosage. So the starting dose, obviously we start you off at the starting dose. Why? Because one of the risks associated with intracavernous injection therapy is not just pain from some of the vasoactive components that we give you, but more importantly, what could potentially happen is something called priapism, where you're maintaining an erection longer than 4 hours. And that could create problems in terms of oxygenating your erectile bodies and your tissue. The penis, like any other organ, needs oxygen. So if you're depriving it from oxygen with that continuous blood flow, what could potentially happen is long-term damage to the penis. So so we set the starting dose. We start you off at a reasonable low dose, and we tell you to slowly increase yourself up by 5 units, sometimes 10 units, but essentially slowly increase so you're not so you minimize your chance of having a priapism event, again, having long-term side effects. So full erection comes down in a reasonable period of time, ideally less than 4 hours. And then every once in a while, if you do have that the priapism event, what we could do is give you a reversal medication. There's some oral therapies we could recommend at home, but a lot of times patients would have to go, or sometimes patients have to go to the emergency room if it is lasting longer than 4 hours. And then more importantly, this is the most thing that I always try to preach is don't use this more than every other day. Using it daily obviously is going to increase, because it does have some lingering effects in the penis. So if you give 20 units today and 20 units tomorrow, the 20 units from today could potentially a little bit of residual effect in the penis. So it's going to have a stronger effect a stronger effect tomorrow, which could potentially increase the risk of priapism. So what do you do to prepare for the injection? So really, it's very basic. You need 3 things. You need a medication vial, you need the syringe, and you need alcohol pads, right? Essentially, these are the 3 things that you need. So what you do is, in order to draw up the syringe, and I'll show you how to do this, but as we mentioned, your physician will tell you what dosage and what the number of units that you're going to use. So if it's 20 units, 25 units, 30 units, generally we start you off at about 20 units, depending on bimix or trimix. And then what you do is you remove the cap, you expose the needle, pull the plunger back to the indicated dose, fill the syringe with the air. Then what you do is you inject the needle into the plunger, into the vial. It's upside down. And then you inject the air into that vial. And then what you do is you slowly pull back to that same dosage, 20, 30, 20, 25, 30 units, whatever it may be. And at the end, you really want to tap in order to get the blood out. Excuse me, the air bubbles out, because you don't want to be injecting air bubbles into the penis. If you do small bubbles, it's okay. We're talking about large volume of air. You don't want to inject it into the penis. Not that it would have significant, it could have potential issues as a result of that. So obviously we want to minimize that. So when it comes to the injection, remember, the key thing here are the landmarks of the penis. So this is a cross-section cut. You're looking directly at the penis. So at the top of the penis we call this the neurovascular bundle. So that's where the blood flow, as well as the nerves for the penis run. The blood flow to the skin. And then at the bottom is the urethra, right? So we don't want to inject it into either one of those areas. So you really have anywhere from 12 to 6 is fair game. We usually, just because of ergonomics, we say, anywhere between 1 and 3 o'clock or 9 and 11 o'clock are the best areas to inject, because it really gives you that open area on both sides. If you can see here, really just to inject. You want to go at a 90-degree angle, number one. And more importantly, you want to really hub the needle. By that, I mean, you really want to put the whole needle, you want to bury the needle in the skin. That way you're getting it into the erectile body. A lot of times patients will just get the tip in, and that's just getting into the subcutaneous fat of the penis. So I've had patients who have done it into that subcutaneous fat, and they're like, look, I see a bulge, but I'm not getting an erection. Reason being is if you're getting into the fat, that's not going to do anything. You really have to get into those erectile bodies. That's the key. And then slowly inject, right? Slowly inject into the area. Ideally, you switch sides. If you're doing it Monday, Wednesday, Friday. On Monday, you inject on the left, Wednesday on the right, Friday on the left, back and forth, back and forth. And then in terms of minimizing the side effects, as we talked about, using proper injection techniques is the best way. Just listen to, at least initially, your instructions, whether it's whatever urologist you see mentions this to you, make sure you're following that first dose appropriately. Rotate the injection sites, as I mentioned, 1 and 3 and 9 and 11, left, right. And then use no more than once every 24 hours or once every other day. Again, because the more you use it, the more likely you are to have some kind of priapism event as a result of this. And then finally, you do want to keep these vials refrigerated, not so much frozen, but refrigerated, as it maintains, as long as it's staying in a steady state of a cool temperature, the vasoactive components are potent, and they stay in their potent state in order to provide good efficacy when you do inject it ultimately. And the bimix and trimix multi-vial use are safe up to 28 days, and that's the key there, 28 days. So ideally, you go through a whole vial every 28 days if you can, and then basically re-up every 28 days, because that could lose its potency as a result of prolonged staying in, not using it very often. So in terms of the injection accessories, so and this really, MedMen has tried to make this as easy as possible for everybody. So some guys are averse to needles, so there's the auto injector here on the bottom left. Some people have an issue in terms of drawing it up, so there's the Insulease in the top right there. In terms of carrying, let's say you are going on a vacation, let's say you're going out of town, the Insul tote does give you a little package in order to keep everything safe there. And then finally, a sharps container. Once you use these products, just throw them to the sharps container, and then you could dispose of it appropriately rather than putting these in the trash can. These are biohazard products, so they are disposed of appropriately. If you need more questions, or you have more information on this, MedMD is one of the leaders in the country when it comes to intracavernosal injection therapy. So that if you have any questions about the side effects, treatment efficacy, dosing, or even how to do it, feel free to reach out. Here's some information from them, their website, their phone number, and they have support staff that can answer all the questions that you do have. Here's my information. As I mentioned, my name is Justin Houman. I work at here in Los Angeles, California, right outside the Cedars-Sinai Medical Center. There's my, if you take a picture of this QR code, that could, it'll save my information. Feel free to reach out with any questions. As I mentioned, I do men's health, sexual dysfunction, male fertility as well. Here's my address and my Instagram and Twitter if you guys are interested. And then we'll jump into the Q&A here. I'll do a demonstration, right, Austin?
That's right. I was just about to tell you. So if you stop sharing your screen, we'll go into the demo portion with the full screen on the webcam.
So yeah, I have a sample here, so I'll show you. And as I mentioned, you just need 3 things, right? What you need is, number 1, you need the syringe, syringe and the needle. It's an insulin syringe, 1 cc. Essentially, it's a graduated marking for the 1 cc. As you can see here, it has the 10, 20, 30, 40, 50 units. You need the intracavernosal product, whether it's bimix or trimix. You'll have that. This is usually refrigerated, so you take it out of the refrigerator, and you need alcohol swabs. I don't actually have the alcohol swabs on me, I apologize, but what you do is, it's very basic. What you do is you, let's say I need 20 units of bimix. So what I'll do is, as I mentioned, you lift up, you pull the syringe back to that 20 unit mark, right? You'll use the alcohol swab to swab the bottle. Once you inject, you squeeze the air back into it, and then what you do is you draw up, you slowly pull back to 20, right? Sometimes you have to leave the plunger at 20 for it to fill, for the whole syringe to fill, but once it does, you're able to pull back, you leave that down. And then I have a handy dandy here, penis here, excuse me. And the key is when you're doing this is, ideally you want to do it at the base, right? Whether it's the left or the right. And as we talked about, 1 and 3, 9 and 11, right? Those are the key areas at the base of the penis. And what you do is you put the penis on stretch, obviously not that kind of stretch, but just enough stretch. And what you do is you inject directly into the base. And what I would do is, if you do it on the right today, a couple days from now, you could do it on the left. And slowly, what you do is you just hub the needle. The key is hubbing the needle. You don't want the needle hanging out too far out, because it gets into that, not into the erectile body. So once you hub the needle, you slowly inject and you pull back. And a couple other things about this is, so if you're laying down when you inject, or you have somebody else injecting for you, that's fine. Obviously that's fine, but the best, in order to really have a good response to this, you want to stand up and you want to self-stimulate before you're getting that erection, because just standing up creates enough gravity, puts enough pressure on the venous system of the penis to create that venous collapse and that venous obstruction, to allow for good arterial blood flow while preventing it from coming out. So do stand up, do self-stimulate. Otherwise, you may not get a great response if you're laying down the whole time. And then, you could hold after you inject, hold the penis for, 10, 20, 30 seconds, just to make sure you're not getting any bleeding. And the other thing is, make sure you're avoiding the veins. You'll see some guys have a lot of veins on the penis, some guys not so much, but either way, they're very obvious on the skin. So just do try to avoid it. It's easy to avoid. But if you get it directly into the vein, you may get a little bit of bleeding. Just compression for about 30 seconds should do the job. Yeah, so that's the process. Very straightforward. Some tips that patients, this is a handy trick that one of my patients taught me a few years ago. What they do is, they know that they're taking 20 units a day, right? Or 20 units each time they want to have an erection. So at the beginning of every week, or for them it was every 2 weeks, what they would do is, like on Sunday night, they go in their refrigerator, they knew that they planned on having sex 5 times in those 2 weeks. So what he did is, he took 5 of these, drew up 20 units in each of them, and put these syringes in his refrigerator, right? So then when he wanted to have intercourse, all he did was he would just go into the refrigerator, he capped the after he drew up the syringes, he tapped them, put them in the refrigerator so it stays refrigerated. When he was ready to go, he pulled it out, put the penis on stretch, alcohol swab the side, and inject himself, and he was ready to go. So that's a nice trick that you could do as well. So you're not always drawing up. But even if you are drawing up, as you could tell, it's a straightforward process, very simple, yeah, it's not too difficult to do.
All right, so if we're done with the demo portion, we can go ahead and get into the Q&A portion of the event. So I got a question here from someone. It's kind of similar to what you were just talking about. They say, I have 7 years experience using Trimix. My process is to fill multiple syringes with the appropriate units. I then freeze them for use later. I thaw and use as needed. What are the risks of freezing them?
Yeah, so freezing them, it's a good question. It's a very common question. So freezing them, as you can imagine, so as I mentioned, you want to keep it in that steady state. So if it's in the refrigerated cool state, the vasoactive components are staying essentially at their same level. So efficacy and side effects are minimized when they remain stable. Like anything else, the chemicals, you want to keep them stable. When you do freeze them and thaw them, that whole freeze-thaw cycle could potentially decrease the efficacy. So when we say 28 days, there's a reason why, because there's been some science to support the fact that after 28 days, it does lose its efficacy, number one, even if you do freeze it, because it's either it loses efficacy as a result of 28 days, or that freeze-thaw cycle throws off the chemicals in that steady state, and again, could decrease the efficacy. So if you do want to have good, strong efficacy, and you want to maintain a regular response to that same dosage and same volume, do try to maintain them and keep them refrigerated for no more than 28 days.
Is there medication that does not have to be refrigerated?
Is there medication that doesn't have to be refrigerated? Is that the question?
Yeah, I'm guessing he's talking about injection medication that doesn't need to be refrigerated.
Yeah, so there's something called EDEX, EDEX. What EDEX is, it's so for guys who want to go traveling, they could use it. It's not, it's only one component it only has one vasoactive component in it. So it's not as efficacious, but for guys who are traveling, yeah, that is something they could use. But again, because it's not Trimix, it's not as powerful, or it's not as strong. Some guys don't, or a lot of guys don't like using it, but there is. EDEX is the name.
All right, next question here. I get an aggressive burning sensation after injection. It persists for 2 hours, and I get swelling and blisters at the rim of my penis for 3 days. Is this an allergic reaction?
If you said you were just getting pain with the injection, I would say maybe we could take out the alprostadil component. But if you get the blisters on the skin, even though you're injecting into the erectile body, potentially, that may be an allergic reaction. What I would do is, number one, I'd stop using it now. I talk to whoever prescribed it to you, whichever doctor that was, and see what they can do for you. Because if they can't, feel free to reach out to me. Obviously, I could provide some kind of advice as well. But that does sound like an allergic reaction. The blistering, you shouldn't get blistering with these. So that does make me think this may be an allergic reaction, yes.
All right. I have had several occasions where I would develop an edema from the injection. What is causing this, and should I be concerned?
An edema. Depends where the edema is. If the edema is on that skin level, my thought would be that you're not injecting it far enough. You're just getting it right into that. Rather than hubbing it all the way, you're kind of just getting the tip in. If that's the type of edema you're talking about, if you're getting full-on edema of the superficial skin of the penis, that may be an allergic reaction. But edema with this, you should, I'd give the same advice. Talk to whoever is the one that prescribed it to you to see if they have any advice, or if they could actually see what you're talking about in terms of imaging.
All right. Sometimes when I take the injection, it has no effect. Why?
Yeah, good question. That's a very common question. So, number one, it could be because you're not injecting it correctly. So there's a number of things that could cause this. Obviously, poor injection technique. Not to say that you are, obviously, but I would tell you across the, if you can just, in order to break it down, to troubleshoot this, it's not being injected appropriately, number one. Number two, you're not standing up, as I mentioned. You got to stand up and self-stimulate. That could potentially help. Number three, the dosage is off in terms of the concentration of the vasoactive substances. And number four, you don't have enough volume. So there's different things. Now, if the technique is right and you're standing up and you're doing all those things correctly, the next thing I would say is, hey, maybe you're just not getting the right dose, especially if you've been using the same dose for years. If you've been using it for a while, your body, sometimes you just need to increase the dose. So that could be what's going on.
What is the average time my penis should stay hard using injection therapy?
It's a good question. So I tell patients that it should last for at least one ejaculation, at least one. Otherwise, if you're not ejaculating from it, what's the point of using it? If it's lasting longer than that, and you're able to go for round two, and you have no problem doing that, great. But the reasons to be concerned, there's two reasons to be concerned. Number one, it's not lasting long enough to allow for one ejaculation, or it's lasting longer than 4 hours, where you compromise that, the oxygenation to the penile tissue. So otherwise, there's a lot of normal in between those two areas. But there's no tried and true saying, hey, listen, it's supposed to last 30 minutes, 1 hour, 2 hours. Your biology is different than mine, which is different than the guy next to you. So there's no, just make sure it's lasting long enough, but not too long. Those are the two things to be aware of.
All right. Is it possible to have multiple orgasms with injection therapy?
Definitely. Like you can have, like I said, if you go for round two, great. Some guys are able to do that, and that's wonderful. But if it's again, the erection is lasting way longer after round two, after the second ejaculation, then hey, listen, maybe we should lower the dose or find a different concentration for you.
All right. How long do you wait after the shot for best results?
Yeah, so about 5 minutes. Within 5 to 10 minutes, you should have some kind of result. If you're not getting that result with standing up and self-stimulation, then at about 10, if you're not getting it at about 10 to 15 minutes, I'd say, hey, listen, maybe we should talk. Maybe we should alter the dose. Maybe we should fine tune it. Maybe give you a little bit more. But within 5 minutes, 5 to 10 minutes, you should have some kind of response. But again, if it's not happening at 15, talk to whoever prescribed it to you.
How do you have spontaneous sex using injection therapy?
Yeah, so that's there's things that we could do to make it a little bit more comfortable for you. So the refrigeration technique that I talked about, drawing up 10, 5, 10 vials, whatever it is, and leaving it in the refrigerator. And then what you could do is, even before intercourse, even before foreplay, inject yourself. Then you could engage in foreplay. Obviously, it's not perfect. It's not like a spontaneous erection, but if it does, if that's doing the things before foreplay or trying to inject yourself before foreplay could help. That's probably the best advice I could give you in terms of patient experience, in terms of what they have told me. So inject yourself before and then engage in whatever it is, and that should maintain some spontaneity to it.
All right, next question here. Is there a risk to using a penis ring in addition to injection therapy?
If you're using a penis ring, when you ask that question, my thought is that the injection therapy is not doing enough, hence you're using the penis ring. I'd be careful. What I would do is I'd stick to one. The penis ring could have a lot of side effects. Number one, it could cause one thing is, and I've seen this, is it's more with the hard penis rings, not the rubber ones, but I've seen it where they get such a strong erection after they put the penis ring off. After they put the penis ring on, they get such a strong erection. I mean, they've come into the ER and we've had to use a Dremel to cut that ring off. Some guy put a metal penis ring on, and we had to use a Dremel, and if we put a tongue depressor between the cock ring and his penis in order to protect it, we had to use a Dremel to take it off. So I would say no. The answer is no. You optimize yourself from an injection standpoint, increase the dosage, increase the volume, rather than putting on a penis ring. Don't do that.
All right, good tip there. Can I use this therapy if I have glaucoma?
It depends what kind of glaucoma, but it should be safe. So to answer your question, yes, you should be able to. The reason being is this doesn't go systemically. It stays within the penis. Unlike the oral Viagras and the Cialics, those act all over, primarily the penis. Those have some side effects. But when it comes to the injection therapy, you should be able to use this fine. If you have glaucoma, if you start to experience any side effects, number one, tell the person who prescribed you this, and also seek consultation from your ophthalmologist.
All right, next question here. I've used both Trimix and Bimix. After a year of use, neither seems to be working anymore, and I have increased potency. Why?
Interesting. So I'm assuming your erections got better because of he says neither seems to be working, but what?
Yeah, so he said that he increased the potency, but neither seems to be working.
Oh, increased potency, gotcha. Couple reasons. So number one, like we talked about, what you need to know, the erectile process, those four things. So as you age, as like anything else, as you age, the kidneys kind of give out, the heart gives out, the lungs give out. The penis is no different in terms of it's not going to work the same way it did when we were 18, right? And so part of that has to do with just the natural aging process of the penis. The smooth muscles aren't as elastic, blood's not coming in the same way it used to. We have issues like cholesterol, diabetes, high blood pressure that decrease the caliper of those arteries that provide blood flow to the penis. That's one explanation for it. The second being, when you inject into the penis, into the erectile area, one thing to be mindful of is you're introducing something into a space that's not used to it. So it does cause some inflammation. And the more you do it, and different guys obviously have different responses to this, but the more you inject, the more often you can inject, that area could develop enough inflammation where it becomes fibrotic. So that tissue that's supposed to be expansile and fill with blood and, to mess with blood, get nice and strong, with more inflammation, that becomes scarred down. So it's not able to expand the same way. It's not able to allow enough blood flow in. So over time, you may get penile fibrosis from these injections. And as a result of that, you're going to have decreased response or poor response to it. So it's not uncommon to keep increasing the dose. You've tried Bimix, you've tried Trimix. There's something called Quad Mix that you could try as well. That could potentially help. But if not, you'd have to go to the next stage of erectile treatments, which potentially to penile prosthesis.
All right. Next question here. I can achieve an erection, no problem, but I do not climax. Why?
Good question. So what do you need for an erection? What do you need for climax, for an orgasm? What you need is hormones, and you need good penile stretch. So sometimes guys will come in, they don't have a rigid hard erection. So think of it as, the guitar strings. If those strings are loose, you're not going to make a good sound when you strum those strings. So you got to make sure those things are taut, right? Those strings are taut, really tight. So what does that mean? Same thing for the erections. If your erections are poor, if you have like a 70%, 80% erection, your threshold for firing is a lot higher, right? For firing, in order to have an orgasm, it's a lot higher. You have to create much more friction. Versus if you have a 95%, 100% erection, that threshold to fire for an orgasm is much lower. So One thing it could be is you need to optimize the injection therapy, or optimize and improve your erections to make them stronger. Otherwise, a blood hormone panel is important, because sometimes there's a hormonal basis to this, and that requires a simple blood test. So I would, if that's an issue, I would seek medical consultation, absolutely.
Right. Since I started using gabapentin, Trimix does not seem to be working. Is there a correlation?
Not that I know of. If you do equate the two, what I would do is maybe stop the gabapentin and see how you do. Unless you really need the gabapentin, I don't know what you need. I mean, what the indication is for you. I would, potentially stop the gabapentin. If not, obviously different people's their biology, they interact in different ways. Yeah, I'd say, or what you could do is maintain the gabapentin and increase the dosage of a Trimix. But not that I know of in terms of gabapentin and Trimix. Not that I know of.
All right, next question. I've heard a lot about the 4-hour erection being bad, but is an erection lasting 2 to 3 hours okay?
Yes, erection lasting 2 or 3 hours. I will say, as long as you're not having pain, if your erection's lasting 2 to 3 hours and you're having significant pain, that may be an issue, because pain is a sign that the penis isn't getting enough blood flow. So that's the one thing. So it's not, everybody's not clearly 4 hours. 4 hours is a really good benchmark for most guys, but if you're having it consistently at 3 hours and you're consistently having a significant amount of pain, that could potentially be an issue.
All right. Can the vacuum pump be used in addition to injection therapy? If so, what's the process for this?
Yeah, so the vacuum pump is actually great in the sense that I like to use it for patients. I like to tell patients to use it because what it does, and MenMD has one, a mechanical one. So I usually recommend the mechanical one just because, number one, it's cheaper, and number two, you have much more control over it than the electric one. So I like it because it provides that stretch to the penis. So those smooth muscles that we talked about are important for penile, for the erection process. It helps stretch them out. So if guys are doing it for 10, 15 minutes every day, every other day, getting that engorgement, getting that full erection, bringing it down, getting that full erection, in some ways it's like a form of penile exercise. So it does stretch the penis, number one. Number two, it could potentially decrease the chance of fibrosis or the effects of fibrosis, because even if that area becomes a little fibrotic, by stretching it out, you're still maintaining that elastic, expansile property of the erectile tissue. So it could mitigate the risks associated with persistent injections into the penis. Therefore, it couldn't allow you to use injection therapy a lot longer. So yeah, I'm a proponent of it for sure.
All right. Can injection therapy be combined with oral medicine like Viagra?
It could, but the injection therapy alone is strong enough to do its own thing. You don't need Viagra. I mean, I know patients who do this and they feel like they're using a smaller concentration of the injection therapy when they're using the Viagra, which is fine, but obviously Viagra has side effects associated with it as well. In terms of the runny nose, stuffy head, that kind of stuff. Oh, excuse me, stuffy nose, headaches. But if you are having those if you really want to use the Viagra with the injections, that's fine. But I wouldn't recommend it. I'd say just stick to one, which is generally the injections.
Okay, next question here. I have variable results with Bimix injections. Sometimes nothing happens, sometimes it works too well. Am I injecting wrong, or is it the medication?
Good question. If you're doing the same thing each time, if you're injecting at that 1 to 3, 9 to 11, you're hubbing the needle all the way, you're standing up, you're self-stimulating. If you're doing all those things, if you're maintaining that entire technique, and if you're maintaining that consistency and you're having variable results, it may be the substance itself. If you're refrigerating it, if you're freezing it, if you're thawing it, that could also alter the chemical activity and the strength and the potency of it. but everyone's going to have a little bit of variation, just because stress hormones, in terms of stress hormones, your testosterone levels vary. If it's that drastic of an effect, if it's that drastic, I'd talk to whoever is prescribing this to you, because what we could do is we could find you a better steady dose. We may have to tinker the dosage just enough in order to give you that, minimize that volatility or that difference. But it is normal to have some variation. There's no question about it. You will have some variation. It's not going to be the perfect same erection each and every time.
Okay. What is the treatment of premature ejaculation due to trauma resulted in hypersensitivity? Any rule for injection alcohol?
Injection alcohol?
Yep, that's what he's asking here.
So if you're having premature ejaculation due to trauma, that's a little bit less common. Usually you have delayed ejaculation due to trauma. But if you are, that just means those nerves are hypersensitized. There's things we can do for premature ejaculation independent of these injections. There's things that we could do in terms of creams, oral therapies, that type of stuff. In terms of injection of alcohol, I think if you mean injecting the nerve to decrease the sensitivity, I would avoid that initially. That'd be a last line. I'd stick to some of the more conservative, less invasive versions, such as the creams and the oral therapies, before we jump into that. Yeah, that's what I'd say.
All right. When is injection right for me? Pills are not working as they once did.
Yeah, definitely. So, in terms of, I tell patients, I promise you, some way, somehow, you will have a good, strong erection. All depends on how aggressive you want to be in terms of your treatment. So if you think of the treatment pyramid, at the bottom of the pyramid is the oral therapies, the middle of the pyramid is the injection therapies, the top of the pyramid is the penile prosthesis. So obviously you want to exhaust all options at the bottom and then work your way up before you get more invasive. So if you've done everything on the oral therapies, you've increased the concentration, you've taken it more increased the dosage of the medication, you've taken it more often, and you're still feeling like you're not getting a good, satisfying erection, then it does make sense to move up, go up to the higher levels, or go up the pyramid, work in the next phase, and find a good treatment option for your ED.
All right, next question here. I'm on injection therapy now. Do I have to use this for the rest of my life, or will my erectile function return?
So it depends. It depends why you're on injection therapy. So some guys, they're on injection therapy immediately after a prostatectomy. Now, prostatectomy, those nerves that stimulate blood vessel dilation, sometimes they spasm and they're not working the way they're supposed to. Sometimes it takes them 12, 24 months for them to come back. So some guys want to have erections immediately after the prostatectomy. We could give them injections. The hope is for those guys, over the course of those 12 to 24 months, once those nerves come back to life, their necessity on, or their dependence on the injections could stop. So therefore, they're able to come off the injections. That's a scenario which guys are able to come off. But if you're on injection therapy for organic impotence or organic erectile dysfunction, once you're on it, you're more than likely you're committed. You're committed to that cause going forward.
Okay. After no use of my penis for over 6 years, can my erections be brought back to life now? I have a new partner and we want to have sex.
Is it after, what was the first part? After no use?
Yeah, so after no use for over 6 years, so after no erections for over 6 years.
He wants to,
yep, he wants to know if he can be brought back to life.
Yeah, so the penis is the expression, like if you don't use it, I believe in the expression that if you don't use it, you lose it, right, with the penis. So if you're not getting good erections, what happens is over time that penis, it becomes fibrotic, or portions of it become fibrotic, like we spoke about earlier. When you're not getting that good stretch, that good blood oxygenation to it, that tissue could degrade a little bit. Now, what does that mean? the penis it's going to shrink in size and in girth as a result of that. So it's not to say that you can't have erections after 6 years, but it may be your erections are going to be a little bit smaller in terms of girth and length. Maybe this is not always for everybody. I hope not, but it is a known phenomenon. We do see that, and sometimes there's things we can do to prevent that from happening, or kind of reverse it. Vacuum erection device being one of them could help stretch it out potentially, but the injections are great because it's going to maintain good blood flow to the penis, and the injections should prevent worsening of that penile fibrosis, because again, once you're getting good blood flow, that tissue doesn't degrade the way it would when you're not getting good blood flow.
All right, next question here. I'm paraplegic. Will an injection give me an erection?
Yeah, it should. It should, yeah. It should be able to give you an erection. It depends what you're paraplegic, and it depends what level you're at. But yeah, what I would seek if that's what you're interested in, definitely seek consultation, because there are some options for you.
All right. Is the injection procedure for men who are not circumcised any different?
No, because so when it comes to circumcised, back to the penis here. So the circumcision, the sleeve, the foreskin sleeve is really at the mid shaft, even closer to the glans, closer to the penis. But generally, it's a sleeve that starts really at the mid glans. All the injections that we're doing at the base, so it doesn't have any impact. Circumcised, no non-circumcised, you could use this injection therapy fine. It's not a problem.
All right, next question here. VED therapy versus injection therapy. Which one of these two therapies offers less side effects, and which is more effective?
The injection therapy is definitely more effective. VED efficacy is it's not great, just because you're reliant on mechanically pulling blood into the penis, and then usually a penile ring to keep it in. And no matter how strong that penile ring, it's very difficult to compress and maintain, compress those veins and prevent blood flow from coming out. So I would recommend injection therapy. If you're deciding between those two, injection therapy is the way to go.
All right. I have experienced the needle bending upon injecting. What should I do when this happens?
Interesting. A couple reasons that could happen is if you're coming in at an angle, that could increase the force and create that bend. But the best thing to do is really come in at 90 degrees. That should minimize. Really coming in at 90 degrees should minimize that angular effect. It should keep, it should maintain that needle strength. Obviously, the needle's insulin strength, so it's small. But coming in directly at 90 degrees should really help to prevent that. If you continue to experience that, sometimes what's happening is you're getting a fibrosis, that area, if you're doing it for long periods of time, that area is becoming fibrotic, and it's harder to inject. So that may be creating a little bit of strain on the needle. So what I would say is potentially what you could do is you could move up a little bit or move down from that typical site, move closer to the base or slightly higher than your typical injection site to see if that you could find some soft erectile tissue there for you to inject into.
Right. Next question here. I have a big belly. Do you have any tips on how to inject when you have a big belly and visibility is limited?
Yeah, so I have a lot of patients who are like this, and some of them are able to figure it out in terms of as long as you're able to see the penis, you could do it. But most of the time, they have their partners do it for them. And once you have a good, honest conversation with your partner about it, it becomes a much easier and much kind of a teamwork situation. So a lot of them have their partners inject for them. But really, the key is if you're able to see your penis, you're in business. If not, getting the support of your partner is very beneficial for that.
All right. We got a few more questions. We got time for a few more questions here, and then we'll wrap it up. Heard a lot about sound wave therapy, like Gaines wave. Does that work? And if so, does it work with this injection?
Yeah, so it works with anything. If you're on oral therapies, if you're on injection therapies, it doesn't matter what you're on. The sound wave therapy, what it is it's a form of, it's our only form right now of reversible therapy where it could potentially reverse erectile dysfunction. Now, what does it do? It's essentially high energy sound waves that stimulate the erectile tissue to increase, we call it angiogenesis, to increase more blood vessel growth. So what's an erection? It's more blood vessels. So by having more blood vessels, you're able to have stronger erections. It's a newer technology. We're still learning about it. If you asked me a year ago, I would have said anecdotally, patients love it. Now we have good data, good science to support it, that it actually works. It works well. There's good science saying, hey, this actually works. They have animal studies that they've taken rat biopsies, rat penile biopsies, and they've seen that it's reversed the signs of erectile dysfunction. Humans, we can't necessarily do penile biopsies, but there's good clinical data to support its use. Patients like it, so yes, it's a good form of therapy. Whether you're doing it with oral therapies, injection therapies, doesn't matter. You could use it in conjunction with any of those.
All right, I have essential tremors. My wife can't stand needles. Any suggestions on alternate ways to inject?
Yeah, there's different things. Like the inject ease is one thing that could potentially help you. I understand that this could make it easier to at least inject once you localize the penis and get the needle or get the device onto the penis. But it depends on how bad the tremor is. If you're able to get it close or near close to, or at least localize it to the 1 to 3, 9 to 11 portions of the penis, I would use something like this. Otherwise, a discussion with your wife, potentially having somebody see or having somebody teach you how to do it in front of her, then having her do it under the guidance of some kind of an educated or whether it's a urologist who's teaching you, essentially teaching her how to do it could reduce the taboo associated with it from her end. But there are some options. I would say this and appropriate teaching with your partner are probably the best.
All right, we had someone who commented, said the injectees is great, so we've got 2 supporters on that one.
Yeah, the injectees work well.
Yes, it does. Let's see. I used to take Cialis 5 milligrams daily, which helped my prostatism as well as ED. Is it wrong to continue with Cialis if I use injections?
No, it's fine. So I was going to say this during the Viagra question. So Cialis, unlike Viagra, so Cialis actually has 2 indications. Number one is erectile dysfunction, but also it's used for BPH. At low doses, there is some efficacy in terms of opening up that prostate to allow for good blood flow. So good urinary flow, excuse me. So if you are on Cialis and you're noticing the benefits primarily from a urinary standpoint or prostate standpoint, it's okay to use it while you're using the injection therapy for the erection. So yeah, no problem at all. No problem at all.
All right. Last question here. Do men need to have a strong libido and a minimum testosterone level for injection therapy to establish an erection?
Yes, you have to have. So it's an interesting question. So my testosterone requirement is different than yours, and it's different than the guy, an NFL player, for example. Now, is there to say, hey, listen, you need 200 points of testosterone in order for this to work for you? No, there's no way of saying, because again, our biologies are all different. However, I will say, if your testosterone is low and the injection therapy is not working perfectly, I would say let's increase your testosterone levels, right? Especially if you're having symptoms of low testosterone. If your testosterone 200 and you're complaining of low libido, erectile dysfunction, fatigue, not exercising the way you used to, you're tired all the time, I'd say, hey, listen, let's fix your T, then let's see how you do on the injection therapy. If that works, great. But and if it doesn't, then what we could do is increase the injection therapy dosage or concentration. But testosterone is a big component of erectile function, so normalizing those levels is important. Absolutely.
All right, and with that, we will go ahead and wrap up the event. So I would like to thank you, Dr. Houman, for taking the time to present today. We'd also like to thank everyone listening in for attending this MinMD Real Talk webinar. We hope it was informative and you'll join us again in the future. If you'd like to learn more about injection therapy, there are also more resources in the Resource Center on minmd.com. Visit this page to view instructional videos, guides, expert articles, and much more. You can also call MinMD at 857-233-5837 or log in to the password-protected secure MinMD portal to schedule an appointment with a MinMD clinical case manager. If you're interested in any of the injection accessories, like the injectees, you can learn more or purchase accessories on the shop page in the MinMD portal. We'll also be sending a follow-up email with references to helpful resources and links to each after the event. So with that, I'd like to thank everyone again for attending today's webinar, and we will see you at the next one.
Thank you, everyone. Thanks, Austin.